Hello and welcome to Health Matters. This is a presentation by the Fortified City International Ministries here in Minnesota. Stay tuned and we'll be right back.
Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it.
Hello and welcome again to another edition of Health Matters. I am your presenter, Patience Blay, and I have with me my co-presenter, Fasia Hilton. And tonight we will be talking about seasonal allergies. This is springtime. I'm so glad we are in spring. I was telling Fasia before we came on live, I was telling her how I love springtime. Do you know why? Because I don't have to deal with a lot of snow. I don't have
Yes.
to drive in a whole pile of snow. And I don't have to deal with the squashing sun. Sometimes the sun can be very, very hot. I don't have to deal with that. And springtime, scripturally, it's a time of renewal. It's a time of reminder that, new things is taking place. God is doing new things. So
Yes.
springtime is a time that you see all the freshness, things are springing forth. So whatever it is that happen in your life, there is hope. So spring represent newness, it represent hope, it represent rejuvenation, it represent new things. So if you are here with us this time, I want you to know new things are about to spring forth in your life in the name of Jesus.
Yes.
You are welcome to Health Matters. And tonight is seasonal allergy. I have Fasia will be telling us all about, or almost all about what we need to know about seasonal allergy. Fasia, you are welcome as always. And my co-host, I promoted her to co-host. Like,
Good evening, everyone.
yeah. It's always good to have you, Fasia.
It is great to
Wonderful,
always be
wonderful.
here. Great to
Yeah,
always be here.
yeah.
Well,
So tonight
as the
is
presenter said, my name is Fasia Hilton, your co-host for Health Matters. It
yeah.
is a pleasure to be here.
Thank you. Thank you, Fasia. We're talking about seasonal allergies. What is it? Because we in springtime and we know that it is the time of the season that you hear people talking about, oh, the allergies, my allergies, and they even go to the extent of owning allergy. Please don't own it. Just talk about allergies. You have the allergies. Do own it. Do personalize it. My allergies. No. So, but it's happening though. But help is on the way. Fasia, what is allergies? What are we talking about?
So allergies, as you said, we just enter spring in on Sunday. So
Yeah.
the spring season is the season for allergies, and allergies can be very, very brutal. I'm a recipient of that. I have history of allergies, and I think most of us that comes to the States, we get introduced to that. But what is allergies? So I'll just give you the medical definition. Allergies are your body's response or reaction to a normal, harmless substance, such as pollens, molds, animal danders, latex, like the latex gloves, and certain types of foods, and then insect stings, like bee stings. Okay. So this is just your body's response to the substance that your immune system mistakenly identify as harmful to your body in layman's terms. Okay. So
Okay.
as we know, during the springtime, that's when the infamous pollens starts to bloom, starts to blossom. That's when the weeds in your grass starts to blossom. The dandelions in your grass starts to
Yeah.
blossom. Okay. And so we get those little seeds that are in the flowers in the grass. We call those pollens, and those are what we are our system is allergic to, because our immune system mistakenly think that, oh, this is a harmful substance in the body.
Yeah.
So it builds up an immunity to it. So it's your body, your immune system reacting to it, trying to protect you. But
Yeah.
instead of protecting you, it builds up histamines that kind of clogs your nasal passages. It clogs your ears, and it clogs your tear duct. Okay.
Yeah.
So there are two structures in the face that when your nose is, when you're congested and you're full of mucus, or in layman's terms snot, it blocks two structures. And those two structures, this one is called your nasal lacrimal duct, and we call it in layman's term, is your tear duct. Okay.
Okay.
So that's the duct inside of here. It blocks it. And your tear duct is supposed to drain out tears into your nose.
So
Okay.
what are some of the symptoms?
Some of the symptoms you will have, that's what I'm trying to explain now. When it
Yeah.
blocks that tear duct, you start to have watery eyes,
Okay.
because that tear duct is blocked. And then it also blocks your eustachian tube. That's the tube in your middle ear. And
Yeah.
so, your ears, you feel like you're in a hole.
Mm.
You feel like you're down in a dungeon. Okay. Yes. And then it causes you, it causes your nose gets congested, and you start to have running nose. And then you start to sneeze a lot because of the allergies. Sometimes
Yeah.
it can cause you to have what we call hay fever, or it's just little skin redness or itching on your skin. It can cause you to have that. It can cause you to have difficulty breathing.
Mm.
So there are a lot of common symptoms that it can have cause you to have what we call post-nasal drip, where you drip in the back of your nose, in the back of your throat.
Okay.
So those are the common symptoms that we have with seasonal allergies. And sometimes
Okay.
your
So
face can swell as well.
yeah, I know that you know, a lot of times where I've experienced, allergy, especially, a time like this. So I know there are a lot of people out there that, you know, want to know more about what is happening. Is it curable?
No, it's not curable. It is, you can do some stuff to help to prevent it or to minimize it, but it is not curable. And let me just clear out three of the common myths that goes with skin allergies. So people might say, oh, when you become an adult, you cannot get allergies. That is false. Because the older we get, the less our immune system decreases.
Yeah.
Okay, so yes, an adult can be a child and don't have allergies, and you can become an adult and develop allergies. The second myth is people will say, oh, you need to eat honey to help prevent, the allergies, because, and the thought process is that bees get their honey from pollen, because we're saying that most of the allergies comes from the pollen, but that is false. That is false. And here is why. So yes, bees get their pollens from they get the pollen from flowers to make the honey. But most of the allergies that we get, we do not get them from flowers. We get them from tree pollens. We get them from the dandelions, and we get them from grass. So that myth about eating honey and that will reduce your allergy, that is false. And the third myth is that, using nasal decongestant, will help relieve that using nasal decongestant is good. No. Especially for a long time. Yes, you can use the nasal decongestant. When I talk about nasal decongestant, I'm talking about the common one, the over-the-counter, is Afrin, that you can go and buy, and it works very well. But it's only for a short-term use. If you use it too much, what it does is it blocks the blood vessel. The nose is very vascular, meaning it has a lot of tiny capillary blood vessels in the nose. That's why you see when people have a lot of nosebleed, is because of the dryness in the air. Then those blood vessels crack. And that's why you have nosebleed. But I mean, I'm deviating from the subject, but I just want people to understand. So that nasal decongestant, the Afrin, it should only be used on a short-term use. If you use it a lot, then it causes what we call a rebound effect. And now your body gets dependent on it. And it can cause a lot of problems. It can also cause you to increase your blood pressure, because it's a decongestant. So those are the three main myths that people think, if I do this, then it's true. It's not true. Yes.
So is it contagious?
No, seasonal allergy is not contagious. No. I mean, granted, if you sneeze in your hand and you don't wash your hands and you touch the door and you have runny nose, if somebody goes and touch it, yeah, it's a fine line.
Okay.
Yes.
Okay. What's the thin line between seasonal allergy? I know we're talking about seasonal allergy, but what's the thin line between that seasonal allergy and COVID?
Oh, COVID is a virus. I mean, COVID.
Yeah, because sometimes, some of the symptoms of allergy, you find, those symptoms with COVID too. So how can someone do that?
You will highly find somebody that will be hospitalized because of a common seasonal allergies. Now, there are different type of allergies.
Yeah.
What I'm talking about right now is the pollen allergies. Now, okay. if you go into skin allergies, then, or if you go into insect bite allergies, where you get a bee sting, and then your body, develop a swelling where, depending on where it is, your windpipe could close and you can't breathe, and you have what we call an anaphylactic reaction. Then yes, you have to have an EpiPen for that. So EpiPen for that. So if you have a child that's allergic to, if there's a food allergy, the most common is like peanuts.
Yeah.
Like my daughter, she's allergic to peanut allergies, and she bee stings. So she has to have an EpiPen for that. EpiPen is a medication that's in a little injectable thing that's like a pen,
Yeah.
and they it's an epinephrine that they can use to counteract that severe reaction to open up their airway. So yeah, so that's a big difference with the COVID virus and seasonal allergies.
Yeah. The reason why I asked that question is because, allergies, when you have allergy, I experience allergy at different levels. And I did have like a fever and I was sneezing. And, those are one or two of the symptoms that you have when you have like COVID. So most of the time, uh, you know, even during the time of the high season of the COVID, and whenever someone sneeze, you find people like they didn't want to differentiate whether that was that was a COVID sneeze or
Right,
there's
because
no
I
way
mean it's the
for
virus
someone
down,
to
so you
know.
don't know if
You don't know what kind of
yes,
sneeze
and
is
when in
that.
doubt, you want to look on the COVID side.
So by the time you sneeze, everyone was like, take cover. They won't say it.
Yes.
you know, just our action alone was saying that you find your way because you don't know what that is. Maybe it could be something that could spread it. But we glad that we're not totally out of the woods yet, but it's a little, it's kind of minimized by the grace of God. Nevertheless, please continue to take all the necessary precautions and make sure
Oh
you do
yes.
all the universal safety precaution. Washing your hands properly, use all your sanitizer, wear your mask if you especially among crowded places, crowded places, and there are places that it's still recommended, it's still required that you wear your mask. Like when you go in, to the government facilities and stuff, it's still, some it's still required, and you're traveling, you still have to wear that mask. So
Oh yes.
don't forget to keep something extra because sometimes we get so um we get
Complacent.
so
Yeah.
relaxed, yeah, and we
Yeah.
feel that everything is gone and it's almost gone. So let me just leave my mark. So no, take an extra, keep an extra, in whatever place you can keep it at, as long as you are taking it along with you when you go in, like in your purse or maybe in your a jacket pocket or
In your
something.
car.
Yeah, in your car. Yeah, most especially
Yeah.
in your car. It's always good to have a spare there. So keep your marks, keep going with them. And even in the polling season, this season, sometimes it's just good, especially if your immune system is not too strong. You can, wear your mask. It even help. It help to from help you from getting all this seasonal allergy. So, Fasia, we we are into spring, and how long does this allergy last? The season, how long does it last? Approximate.
Well, it will start in spring, but it can go all the way through the fall because the pollens are still there. You still have grass when people are mowing their lawn. Your allergy can flare up.
Mm-hmm.
So it goes through the summer. But
Okay.
let me just add that with this seasonal allergies, I tell my patients that if my patient has asthma, if they
Mm-hmm.
have eczema, which is a skin rash,
Yeah.
if yes, and seasonal allergies, those three run hand in hand. So if you have asthma, you are more prone to getting seasonal allergies and to getting eczema. If you have eczema, you're more prone to getting seasonal allergies or asthma. So they intertwine, they run together. So don't be
Yeah.
surprised if your child has asthma, they develop eczema or they develop seasonal allergies and vice versa.
Okay. So that's a very good one. Good information for those that already suffer from asthma. Um. Sorry. Let me see. Sorry, I can't take this call right now. Yeah. Okay. Is there uh, any symptoms specifically that we have to that is more severe than all the other ones? Like we know you have runny
It
nose,
just,
you have
it's
watery
just, it just
eyes,
depends.
some your ears itches and all that.
I think when you can't breathe,
Okay.
then that's an issue. Or if the child has asthma and they start to wheeze, then you need to, you make sure you have their rescuer inhaler or their nebulizer treatment available for them to take. Because with the allergy, what it does, it makes your bronchial tree inflamed. It makes your nasal passages inflamed, so that can cause the child to wheeze. So,
Okay.
you know,
So do you have to go to apart from the severe cases like you talk about the the shortness of breath of it's difficulty breathing, let me put it that way, difficulty breathing, and apart from those that usually have the asthmatic attack, do we have to go through like any healthcare facility for treatment?
well, if you
What
have
can we do? What's
insurance,
the most
you
common
yes,
home
you
remedy
can
that we
go to
get?
see your you can go to see your primary care provider or doctor to diagnose you. Because most times people will not know what it is.
Yeah,
So
yeah,
I'll recommend that you see your healthcare provider. There are over the counter treatments that you can use, but you have to be very careful. We have antihistamines that you can use, like the Claritin or the Zyrtec that you can use. Now the nasal spray, they have the best nasal spray to use. I will not recommend the decongestant like the Afrin.
okay,
I would recommend the nasal corticosteroid nasal spray. It is now over the counter, and those are sprays like the Flonase or the
yeah,
nasal quart. They're now over the counter that you can buy. You don't need prescriptions. You can use that and use your Zyrtec or your Claritin that is over the counter. Now, if you don't have blood pressure issue, yes, you can use a decongestant, but you just have the pill, not the spray. You have to be very, very careful with that Afrin nasal spray. I mean, I'm saying Afrin because it's the most common one that we all know. But as long as it says nasal decongestant, if you're going to use it, you have to be very, very careful and not use it all the time because it works so fast.
yeah,
It works so fast. You put it in your nose and you feel like, oh my God, I can breathe. I can hear, my ears are open, and you feel
yeah,
good. But then your nasal passages gets inflamed, and then every 2 minutes you want to spray. No,
yeah,
because you will get a rebound effect, and that can cause you to go into really, really severe sinus infection, what we call sinusitis, and
hmm,
that's inflammation of the sinuses. So you just have to be careful with that, and especially with babies. I would say go see your healthcare provider because the medication dosage, you have to be very careful with infants and with children. So you have to know how
yeah,
much to give them because you don't want to
okay,
overdose them. That can
that's
that can
right.
also have an adverse effect. And then also, if you have allergies, you have to be mindful also with pets like dogs and cats,
Hmm,
because cats,
yeah,
a lot of people that
they
have
can.
allergies, they are
Hmm,
severely allergic to cats. And you might have the cat and you don't know why. Your skin is itching, or you keep having this runny nose that just will not get better. It's because of the cat or the dog. Now they do have hypoallergenic dogs and cats. They're different breeds. I think dogs like Yorkies. I think those are. Don't quote me on that, but there are certain dogs that are hypoallergenic that a person that has severe allergies can have. So you
Mhm.
have to be careful with that with those two pets.
Okay. And then there's a friend of mine some time ago. Um, I've been some years now, years back, but I think I remember, the person had uh, allergy, and they wanted something from over the counter to take, but they also had
Hmm.
this condition, like they had hypertension, and they were kind of, I saw they were just looking at the label and trying to figure out which one was
Yes.
the best one. What advice do you have for
Yes.
those people that have those kind of conditions and they have allergy,
If you, especially, and that's with people with high blood pressure. If
high
you
blood
have high blood
pressure?
pressure, stay away from decongestants, because what it does is it what we call it causes your it can raise your blood pressure up.
Yeah.
So you have to
So
you
what
have to
in
read.
in that case, what can they do to help themselves? Because they can't just
Then
take
you
something from
you
over
can
the
take the
counter.
antihistamine. The antihistamine, like the Zyrtec or the Claritin, those are wise choices to take. And then
Okay.
you just have to study yourself, to know what can flare up your allergies. Some people could
Oh,
be perfume.
oh yeah.
Then it would mean that you will have to wear things that are unscented. You have to wear lotions that are unscented. You have to stay away from perfumes. Your body wash has to be a soap that is unscented, and Dove has unscented body wash and unscented soaps, bath soaps that you can use.
Yeah.
So you just have to kind of study and yourself and just study your environment to see, hey, even carpet. Believe it or not, there's a lot of dust that's in the carpet.
That's right.
So
That's right.
carpet can be the culprit of your allergies and you don't know.
Hmm.
So mhm.
Okay, if you are watching us for the first time, we are talking about seasonal allergies tonight, and this is Health Matters. And as usual, my regular and my co-host Fasia is here tonight. She's telling us everything, almost everything you need to know about seasonal allergy. We are in spring, and we want you to, you know, enjoy the spring and go into summer, having all the, the good time, being healthy. So, in order to do that, be aware of the pollen in the air, and also be aware that there are measures that you can also take to help yourself and to reduce, you know, allergies. So, Fasia, is there anything else you want to add before yeah, we close? You want to conclude?
Yes, always seek medical advice, medical care. Let's take care of ourselves. See your doctor on a regular basis if you have chronic conditions. If not, at least once a year, get your physical exam. You're paying for these insurance, why not use it? If not, your money is going down a drain.
I know,
You
right?
know.
And there's someone here that asked a question. I think he was not here when you were explaining. So let me just put him on so maybe you can. He said, "What are the symptoms of seasonal allergies?" That's his
You
question.
have the runny nose. You have itchy and watery eyes. You have nasal congestion where your nose is stopped up. You can't breathe. Your ears are clogged. You feel like you're in a hole. You're in a dungeon. You want to pop it. Um, itchy face, itchy eyes. Some you sneeze a lot. Um, and if it's severe, you start to wheeze, or you might have difficulty breathing.
Okay. And Stevie is here. He must be, he just, I don't know about, this is his question. And he's the last, that's the comment, the last comment on the screen now. He said, what can you do to stop getting affected by this? So,
Well, I mean, if it depends on where you are.
yeah.
If you're here, there's a
He's
lot
in
of
Liberia.
pollens. You just have to. Oh, he's in Liberia. Well, Liberia,
Yeah.
you can get allergies too. We just didn't know
Yeah.
it,
Yeah.
and everything we
Oh,
said we got
yeah.
flesh cold.
When I was in
Yeah, oh, I got
Liberia,
flesh cold, or I
I
got the
had,
flu, or I got
I
malaria.
really had
You know,
I had a serious, issue with allergy when I was in Liberia. It's kind of reduced since I came here. I want to
and
believe it was
most
mostly
times in
the
Liberia
dust.
too is
Yeah,
is the dust. Yes, the
yeah,
dust.
mm, yeah. So maybe when we have most of our roads, properly fixed, and we have a way to keep the dust up, dusting every night and then our homes and all the carpets that we keep, that when you step, the dust is flying in the air. We don't even know they fly and coming up. I
Yes.
think when we notice those things and we start doing the right things, it's going to reduce. Yeah. But I really, really used to suffer
Yeah,
with
one of the
allergy
good
when I
things
was
back
in
home
Liberia.
is
Yeah.
most of the homes have tile, instead of
Yeah.
carpet. So
Yeah.
that's good.
Yeah. And in Liberia, it was like there was certain time I had to stop going to the market because the first thing that happened to me when I entered the market house, I started sneezing. My eyes start
Hmm.
running, my nose start running. So I just noticed that and I said, well, I have to stay away from the market. Other than that, it was really, really serious. And I knew that maybe from the pepper, all the different stuff. Yeah. But thank
And
you
that's
so
that's
much,
the
Fatia.
key. The key
Yeah.
is to know what triggers it, and to
Yeah.
avoid the triggers.
That's right. That's right. Well, thank you. Thank you so much. You want to get your closing statement before we go?
Yes, like I said, let's take care of ourselves. Nobody will do it for you. Only you can do it for you, and you can do it for your children. So just pay attention to your health, and try to do the best that you can to take care of yourself. Take your medications as prescribed. Go to the doctor if you have chronic diseases. Don't be a macho woman or a macho man and say, "Oh, I got that medicine. Let it sit down here on the cabinet and in the cupboard and grow dust." No, you're
I
harming
know, right?
yourself. Take your medication as prescribed.
Thank you. Take your medicine as required. And tonight, this is how we come to the end of Health Matters. The word of God say, by his stripes you are healed. Doctor treats and God heals. So whatever the condition, make
Yes.
sure, like Fasia rightly advised, if you have the time and you are insured, even if you are not insured, make time to see your primary care physician. Make time to see some kind of doctor once in a while and to check yourself. God is still healing, and the word of God says, by his stripes you are healed. And so tonight, I declare healing. Wherever you need healing, sometimes our
Amen.
minds are sick, we need healing. Our bodies sick, we need healing. Even you know, our spirit. The word of God says, a wounded spirit, who can bear? So when everything else fail, when your willpower, when you fail, or when it fails, it's like everything else is lost. You need that strength to carry on, and you need to encourage yourself. Whatever the situation in your life, keep encouraging yourself. The Lord is still there. There are people that might be watching and say, "Oh, God, 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 God." Well, if you don't believe it, He exists. You don't see the air, but it's
Oh
still
yes.
there. So,
Oh yes.
by His stripes, we declare tonight you are healed. May the healing power of the Lord locate you tonight, and may He bring
Amen.
total recovery to whatever the situation is that you are calling on Him for, in the name of Jesus. God bless you, and we will be here again next week for another edition of Health Matters. Your health matters. Thank you so much, Fasil, my co-host. Thank you, our viewers, and thank you
Always a pleasure.
for our regular viewers that are always here, always ready to help us. And those that are coming for the first time, we appreciate you, and we are looking forward to seeing you again. God bless you. Thank you.
Good
Have a
night.
blessed night.